Hello, Violet.
Yeah, did you just refresh
You
your
guys
browser?
But are you Banu and Alamin? Are you guys hearing me?
Yes, we can hear you. Yeah, we can hear you. I also live.
Yeah, because yeah, I don't know if Violet hears me because she's
Yeah, let me
she's
call
not
her.
responding. Yes, please.
So you're live on Facebook and everywhere. Yeah.
You can start.
Okay, great. So yes, so the organizers can be using the 30 seconds to get the other people and the technology to function properly. And since we're live, we can start. Ladies and gentlemen, for those of you who are here, thank you very much for joining the last day of the African Innovation Week. For those of you who have been joining the past 4 days, I hope you've enjoyed some great startups, some good ideas, and some good people, and looking forward to great innovation or greater innovation on the continent. So today in particular, we're going to be focused on health tech, how the advancements in technology and information technology specifically can help boost better outcomes for health in Africa. But before we start, I want to create some kind of context into this. So anybody who has been alive for the past 20 years or 10 years, you may have heard about all the problems we have in Africa related to healthcare. The infrastructure, hospitals not maintained, people not being able to reach doctors, illiteracy, people not getting proper information, people not knowing what to do about their health, solutions that have been imported from outside the continent that do not seem to work, a tradition of receiver mentality, that is, one has been receiving healthcare dictated from outside, and that has not worked very well for the population, increasing costs and the burden of disease on people and smaller families, uneven distribution of healthcare in the rural areas contra the urban areas, lack of enabling environments from governments and institutions to better the situation for entrepreneurs to make healthcare better and more accessible and better quality. So yesterday, the 12th of November, for those who know, was World Quality Day. And there is no other aspect in the world where lack of quality or poor quality affects and has worse incomes than in healthcare. So if you go to a doctor who is not well trained and they give you a wrong diagnosis, that has an effect. Some people go to a hospital that is not clean and you can end up having an illness from a hospital and all of that. But today, we are blessed with many tools that we can use, and we will be talking together with our panelists on how we can use tools in the growing entrepreneurial spirit, the spirit of people like Bezawit and Violet and people who are making change on the continent, infrastructure changes, globalization, access to technology. How can we use all of these things to better the lives and the outcomes of health for people on the continent? So my name is Ate Etaba. I'm a pharmacist by profession. I'll be moderating a conversation for the next 1 hour. I work with a consultancy called Step Change Africa, where we help to bridge the gap by bringing investments and technology and ideas from across the world that have functioned and tailor them to meet the needs on the continent of Africa. So we help African startups that are ready get investment. We help people bridge the gap between them. So if you intend to reach me or to get any idea, you can find anybody from Step Change Africa in the conversation and reach me through them. I think my colleague Andrew is here with us today. But let's get into it. We have two very, very interesting guests here today. I've taken the privilege for the past 2 days to look through their profile and see wonderful things happening. Our own Bezawit here from Norway, who's based in Norway, and Violet in Kenya. So I would like you guys to start by introducing yourself and tell us a little bit more about yourselves and what you do. Bezawit. We're not hearing you.
So who do we start with?
Bezawit. We start with Bezawit. Can you please unmute yourself? Can everyone else please mute? And Bezawit, can you unmute yourself? We're still not hearing you. Maybe you should take off the aid. Beza, we're not hearing you. Could you just check your logging, and then one of the moderators can reach you and help. Violet, could you start maybe by introducing yourself while we wait for Violet to get to us? Beza to get to us.
Hello. It's a
Hello.
Yeah, it's a pleasure joining this lively discussion today. So my name is Violet Mbiti, the founder of Violet Mbiti Foundation, as well as our digital platform, Adolescent and Youth Sexual Reproductive Health, which fills the gap with regards to lack of information for adolescents and youth with regard to them accessing sexual reproductive health information. Thank you.
Great, thank you very much. That sounds like a very good topic. We'll dive into in a short time. Bezawit. Guys, do you Violet? Do you hear Bezawit?
I can't hear her. I think there's some.
Okay.
Hello?
Yeah.
Hello, can you hear me?
Hello. Yes. Yes, we can hear you now. Welcome to the show.
Thank you. Yeah. Okay, shall I introduce myself? Thank
Please
you.
do.
Okay. My name is Bezawit Sima. I'm a public health expert with PhD in global health. And I have been working in the academics and healthcare system in Ethiopia for more than 10 years. Currently, I'm working on my postdoctoral fellowship on Informed Health Choice project, which aims to enable young children in Africa to make informed decisions regarding their health, comparing different claims and information they have access to. So mainly our overall aim is to increase the health literacy of the young population in Africa.
Right.
I found this African Innovation Week HealthTech section very interesting, and actually I believe that we should have a lot of such discussion to bring our ideas together to contribute to the efforts of changing the difficult healthcare situation in Africa. So thank you for having me, and I look forward to discussing this further with you.
Yes, great. So it seems like we have two panelists who are focused on one almost the same area, but we are going to be touching a little bit of different areas, which I have taken an untraditional approach. I have not informed you guys about what we're going to be talking about, but all we're going to focus is human health and how technology can help different aspects of health. So the first thing I want us to discuss is the area in which you guys are working in, because, you know, first there is somebody who lacks information and somebody who has a problem, and then they go to a doctor who may be trained and not well trained, into a hospital which may not have enough equipment, and then they will get more sick, and then they have to handle the disease, and then you have all the things that come up. So in the entire value chain of healthcare, it starts with information, basically what you people are working on, because with better information, people can make proper choices, as you say. So first of all, how can technology today, or how is technology today helping to bridge the gap of illiteracy, which you just talked about, Bezawit?
Yeah, that's actually a very interesting question, because when we look at health literacy, it's not just the issue of addressing those who are not in the healthcare system or who are not trained as healthcare professionals. Health literacy also concerns those who are also healthcare professionals as a whole. Because once you have proper health literacy, so that you have the skills of critical thinking about addressing the health needs of the community as a whole. And understanding the community needs also requires you to understand.
We're having a hiccup there with Bezawit's technology. And that is one of the problems we're addressing today, how we can solve healthcare problems and better healthcare outcomes with technology. And Violet, as you see, as we're talking about this idea of illiteracy and idea of information, giving people proper information, how has your foundation and how is your foundation using technology, or maybe not just technology alone, to better this information flow and giving people adequate information?
Thanks for the question. I can give you a genealogy of even how we started. Violet Beauty Foundation has been engaging at the grassroots, talking to youth regarding their sexual reproductive health as well as adolescents, and we've also been engaging policymakers. So anytime that we go, even when we meet the policymakers, and even conferences that you go to, the thing that keeps resonating is lack of information on sexual reproductive health. So that is when I decided, okay, then since like even when we look at Kenya, we find that like internet mobile penetration is at 80%, access to internet is also very high. So I saw it fit that it would be good to create a blog that highlights that fills this gap by addressing these sexual reproductive health needs that the adolescents and youth need, especially information. So we created the blog, and then we also created the social media handles. And when we created it, we didn't, now for the adolescent youth SRHR, we didn't expect that we are going to get such massive support, because organizations from all over the world were following our page, and whatever content we are putting out, it was some of it was even being retweeted. So it was really nice, and it was also awesome also to present at an adolescent symposium where the director of World Health Organization, Dr. Chandra Muli, the director for reproductive health, was present. And it was because of this particular blog, this particular digital health platform. So I can say that for the time that we've engaged, we've utilized the digital and also the grassroots approach. By going at the grassroots, we have seen massive changes, and we have seen even massive growth, even with regard to utilization of the information.
Great. And this is something I want us to discuss. When you talked about policy, Violet, I have a particular space where I want to ask you very much more into policy, because the enabling environment is also very important for entrepreneurs and for people who want to make change. We know that when it comes to healthcare in Africa, there's a lot of write-up, there's a lot of policy, there's a lot of discussions with WHO over the past 60 years, 100 years, but many of that has not translated to real outcomes, to better outcomes on the ground. So we'll get to that. But when you talk about this massive interest in health information, I have realized that over the years, you see many platforms and apps and blogs come out to give health information. How do you secure that the quality of information on these platforms is adequate for the use of the people? You know, internet is open. People can Google anything. But how do you secure that the people who are on your platform get good quality of health? And you can just address at the same time, how do you, for sustainability purpose, how do you ensure that you continue to be there? Because what we also see is that people come in, give this information, and over time the businesses disappear, and then a gap is created. So could you address those?
Yeah, so first of all, I'd like to address the first question that you had put with regards to policy and implementation. Yes, like African governments, you find that they're very quick, even development of even policies, even with Kenya even being one of them. But you find that when it comes to implementation, that is now where the challenge comes in. Yeah. Okay, so what we've been doing is that we have been engaging them through advocacy to go and having a one-on-one or round table with the policymakers, and also presenting memos to them during public participation exercise and addressing our needs. And I can say that like in last year 2019, we mobilized together with other youth organizations here in Nairobi County, which is the capital of Kenya. What we did is we came together as civil society organizations, and we participated in public participation, and we asked for the county government to increase the budget allocation for family planning, because there was an increase in unintended pregnancies. So what happened is when we presented our memos, even during the budget making process, the county government had our concerns and increased allocated $5 million towards health for the financial year 2019-2020. And this was as a result of advocacy and meaningfully engaging adolescents and youth in the process. So with regard now to your question on the quality of information, before we even disseminate the information online, we do thorough research to know that is quality information. Because at the moment, as we are speaking, there are so many like adolescents and youth. You find that when it comes even to matter sex and the sexual reproductive health, they're so shy they can't approach their parents to go and ask them questions, even if they want to know about sex. So most of them go to Google. So we decided that, and when they go to Google, they find other porn sites. And we saw that is not good, because that is improper information. And they also go to their peers who are also of the same age, and they also don't know this information. So we decided, let us start this particular blog. And now when we started it, we started even ensuring that whatever information that we are putting forth is up to standard. So we ensured that we are looking even at Lancet. You know, Lancet is an article, global article, that also highlights information on adolescents and recent researches on adolescent health and their sexual and reproductive health well-being. So we ensure that our standards are up to par. And we are just so happy that because of even our work, we even got to be invited in this particular forum to speak about our innovation. And with regards to sustainability,
thank you very much.
And with regards to sustainability, that is the last question that you had asked. What we are doing is we are engaging writers. We have started engaging writers who will be contributing toward the blog. Writers who are experienced in sexual reproductive health, so as to ensure that we have different buy-ins from all over Africa. Thank you.
Great. Bezawik is back with us. Bezawik, thank you. You were commenting before about education and accessibility, and we went a little bit further to talk about the quality of education, and you've been listening to what Violet is saying. So if you just want to step in, continue from where you were, if you remember, or just get in to talk about the quality of, because there's one thing having people who do not have access to information. Now with information technology, people are broad and open to the entire world. How do we ensure that the education is, the information is correct, but also fit for purpose? You're still muted, Bezawik. Can I unmute C4 directly? Bezawik, do you hear me?
Hello.
Yes, Bezawik, you can hear us now. We can hear you too.
Thank you. So I was trying to say that when you talk about quality and information that's context sensitive, for an information to be accepted and adopted by a community, it needs to involve the community in its development. If we are thinking about developing an app or some system that we need to reach our community with health information. They need to be involved from the scratch where we are planning to develop it. The problem is the community needs to trust the source of information for them to accept it and to apply it in their day-to-day activities related to their own health. So right now what we are trying to do is, for example, in our project, we are trying to develop, produce a podcast for the community regarding health information in any aspects that could help them choose appropriate information. At the same time, we are developing some digital information for the healthcare system and for the school environment, which could feed up together so that all could have the same understanding. So intercommunication could be easier. So let's say if you take Violet's experience of sexual education, if you teach children in school, for example, to use contraceptives if they are sexually active, they need to feel free and they need to feel accepted by the healthcare providers when they go to seek those services. So what we are trying to do is for the healthcare system to accept them. Let me not go out of your technology idea because I'm mostly taken by the public health agenda. So, but all what we are trying to do is making information accessible in a way which is similarly understandable and brings them to the same understanding through technology, actually. When we see policy in Africa, for example, if we see Ethiopia in sexual and reproductive education and rights, Ethiopia has adopted, for example, comprehensive sexuality education, which is a digital education system. All the information are computer-based, and they have this system that high school students can go and look for those information and apply them. But the problem is it's not implemented in all schools in Ethiopia because of one, lack of infrastructure. There is no system that makes it easy to implement the policy. No digital technology which is in all schools which could make it easier to use. For example, innovators and entrepreneurs could see this as an opportunity to develop an app which could help young generations to search for information that they need when they are concerned about their sexual and reproductive health issues. Yeah. So
I want to comment on something. I want to ask the two of you a very important question. We have all this academic discussion we're having, but let's go back to the context of the rural areas. People's traditional beliefs, mothers educating their children. You get access to them when they're in school. Maybe they're 15 and they're 20 when they're sexually active, but they have been trained for the first 10, 15 years by people who have a different conception. Now, we're not going to take away people's culture, but how do we bridge? What is there a way to get to the parents? Can we use technology, or how is your research, Besawit and Violet, how is your organization working with going deeper into the core of the society to get parents, to mothers and fathers in rural areas, to accept that their children can have sexual education, for example? And of course, you talk about healthcare workers being ready to accept these children when they come. If these healthcare workers are also part of the society and also parents and have a cultural unacceptance for sexual activity among youth, how do you bridge that gap? How do you do that?
Yeah, can I come in?
Please.
So in this regard, it's a very important question, and that's actually exactly what we are trying to figure out in Ethiopia right now. Health choice project. So the point is the problem of conflicting information, and the decision making is mainly on the parents. So most health needs are decided by parents for the young generation in Africa or elsewhere. So if a child is sick, it's the parent who will take system, and that's how usually decisions are made, which medicines they will take, when they have to go, when they should spend some money on the needs of the young generation, on their health needs. So when it comes to sexual and reproductive health, education and rights, there is a culture in Africa that sexual activity should not be initiated before marriage. It's like it's a taboo to
An unwritten rule. Yes.
Yeah. So it's a culture that we are told we should not be active sexually before marriage. But the truth is not that. A lot of unintended pregnancies are happening, sexual illnesses or infections are happening, and HIV is there in a lot in the young generation. This is mainly because even if the young generation is informed, really decide on using the sexual and reproductive health services because there is a barrier, cultural barrier, that's keeping them from seeking this healthcare system and using it properly whenever they need it. So what we are trying to do
is there an issue of affordability too? That they cannot afford because, as you said, their parents pay for them.
When it comes to sexual and reproductive health, most African countries are supported by international donors organizations to provide these sexual and reproductive needs. If you see condoms, if you see birth control, it's free of charge in healthcare facilities to use by this young generation. The problem is a barrier of culture and a barrier of miscommunication or barrier of communication between the parents, the healthcare system, and even those who are teaching sexual and reproductive health agendas. For if you take schools, the teachers are mainly focused on abstinence-only approach when they teach their children about sexual and reproductive health. This is actually because of the cultural influence on the teachers while they teach sexual and reproductive health issues. So this is a barrier which is influencing the healthcare system, the teachers who are addressing sexual and reproductive health issues, and also the parents. So what we are trying to do is networks of parents, networks of teachers who are teaching sexual and reproductive health issues, so that we gather to identify gaps or barriers of communication within these three big stakeholders, so that we can come up with a solution to bring this discussion out, so that the users can freely decide their own sexual and reproductive needs. So
yes, okay, thank you, Viola. Could you jump in there and give us your ideas about what we just asked?
So in addition to what Bezawit has said, yeah, even here in Kenya, what is and also even all over Africa, you find that the best approach is utilization of multi-stakeholders, bringing various stakeholders together so that we can address that particular issue. And this has happened, like now, if we want to reach parents, the approach that we use is the church. If it is Muslims, it is the mosque. So we approach religious leaders. Because at the end of the day, you find that most people congregate on Sundays to go to the different denominations to go and be served. So we've been using religious leaders to get their buy-in. So you find that even as Violet Mbiti Foundation, even some of the areas, the venues that we've been going to share this information is through the church. And we even get like even like 100 adolescents at the same place together with their parents. Okay, so that approach is the church. But the other thing is that we have also found that it is crucial to also engage community elders. For example, like you see, like here in Kenya, there is the Maasai community. The Maasai is a strongly knit community, and they conserve their culture. But you find that FGM is very rampant there, and even any mention of sexual reproductive health is people talk in whispers. Okay, but what we've been doing is we've also been engaging now the community elders. All right, because the people listen more to the community elders because they are the decision makers. And even when going on the ground to go and disseminate this information, to adolescents and also youth and also parents, we found that also a best approach is also to incorporate healthcare workers, because you find that when we go and disseminate, you find that they listen more to a nurse when a nurse when a nurse or a doctor tells them that, you know, this sexual information is very important. You need to do this and do this for your child. Okay, so you find that parents are more receptive, and you also find that even adolescents themselves and youth, they are more receptive to the information when it comes even to a healthcare from a healthcare worker. So the other thing I'd also like to address is you see, like Kenya was a lower is now a lower middle income country. So before it was in the lowest rank. So you found that international donors were coming in to donate even money for condoms, for sexual reproductive health, for commodities, family planning. So you find that a national government is dependent fully on international donors. But now you see, for example, like Kenya, that now is now a lower middle income country, the donors are pulling out. And they are saying that since your economy has improved, you as a country, you need to innovate to generate more income for your country. And Kenya is one of them. So there are countries in Africa who are benefiting from international donors, but there are other countries whose economy has improved and the donors are withdrawing. So now this brings a challenge even to availability of these family or health supplies at the various public health hospitals.
Yes, Violet, I need to just say a statement about that particular issue, because this is the reason we have all of this African Innovation Week and these events, the many of them going on across the continent. How do we transit as a continent from having sentences and statements in, I mean, your healthcare, your electricity, the basic needs of your life? Anybody who donates that to you controls your outcome. Can we actually create a better outcome? Professor, with your researcher, can you create a better health outcome for people if the outcome is controlled and donated by the people who receive the outcome? And would it be specific enough for the people? I mean, we have seen traditionally for the past years, many years, that we've become so dependent on this model of our healthcare in Africa being given for free by countries who actually citizens pay for their own healthcare. Moving down this line, are we going to get there to where we want to go following this same trajectory?
No, I don't believe we are going there with the same model of receiving support from external donors. This is because of the issue of sustainability. Those donor-driven projects are lacking sustainability. They will perish once the donors have done their mission for some period of times. So we need to have our own approach and our own plan to solve those, and we should come up with our innovation and technology that will address the needs of our own communities. And it should change that. We should change the trend that, you know, it's good to have the support as far as we are not there in terms of financial independence in Africa. But the plan for solving those problems in Africa should come from Africa. We should identify our own problems. We should identify our challenges, and we should ask only for some support to implement those innovations and technologies to solve our problems, so that it could be sustainable and more effective in African situations. So
yes, I get that. Violet, let me ask you directly. There's an enormous amount of advancement in technology in the past 20 years across the world. Creation of condoms, it's probably not rocket science anymore as it used to be 30 years ago. Creation of pads and for women, this is open source technology today. Why are we still having the situation where we're waiting for somebody to donate condoms? Why is are the policymakers looking at this situation in the next years to come and say, can we enable an entrepreneurial environment where we would have entrepreneurs solving these basic problems, taking technology that already exists across the world and creating solutions so that, for example, in a rural village, let's say mosquito nets for malaria, rather than getting local women sew their own mosquito nets so that they can use it on themselves, you bring mosquito nets and donate to women who don't have jobs. So, Violet, working with policy people, do you see any change in this mentality? Do you see any progress here?
Thanks for your question. It all boils down to the leaders who are in place, especially the elected leaders like the presidents. And if you find a leader, an African leader or an African president who supports that idea, or who, when he comes in, he ensures that during my time we are going to ensure that we have innovations in place. We are going to ensure that we reduce costs as a country by integrating innovation in what we do. If we found leaders like that, it is possible. So I'd like to give an example here. I give an example of Rwanda. You find that Rwanda, through their president Paul Kagame, they have been able to integrate different technologies that can even reach people even in remote parts of Rwanda. So you find that even in Rwanda, you find that when even it comes to drugs, you find them being delivered remotely through drones. Okay? And also you also find that even when in this time of COVID-19 pandemic, you find that even there are robots that have been developed that are that are curbing the current spread of COVID-19 in that particular country. So you find innovations everywhere. And these innovations you find because you find that the government steps in and says that it's going to support the entrepreneurs, all right? In Kenya, there are youth who developed like the ICU beds. And we also got in the buy-in from even the president when he said that the people who are constructing the ICU beds, they are giving orders. So the government has been directed to take orders from this particular youth so that now the government, the public health hospitals can have ICU beds. So it depends with the current leader who is in place, who is ready to support health technology innovations to ensure that we reduce costs drastically. So at the end of the day, it boils down to the leaders, the elected leaders who are in place, because at the end of the day, you find that when it comes to checks, they're the ones who are going to sign. Okay? Yeah.
Yes, correct. So what you're saying is that even when technology exists, information technology, advancements in science, in order to get that to reach people and reduce the burden of disease and the cost of disease, there must be an enabling environment, and that starts from the top.
Exactly. Like, yes, that one starts at the top. Because, like you see, for example, here in Kenya, during the tenure of the previous former president, he was called Mwai Kibaki. He ensured that he supported ICT, and you find that information communication technology, it was spread out all over the country. And that is the time that we even got fiber. So when you come to Kenya, you find that even the cost of internet is lower and affordable to everyone. And that is why you find that even when COVID-19 came, was reported first year in Kenya, you find that one of the innovations that have also come to place is having people call in, okay? People call in and they're using technology, all right, to ensure that they get services closer to the people. And even Kenya, we are saying even since we had independence in 1963, if this all that time we had a president, but when this particular president came in, that is when ICT now became prominent, and that is why you find that all this technology, even M-Pesa, all of it came during his tenure. That's why I'm saying that it all boils down to the people in power at that particular time. If they are for the people and their needs are for the people, you will find that that country is going to develop. And at the end of the day, even when they do their calculations, they find that when they embrace technology, the cost of doing business goes down.
It goes down.
Yeah, so the ones who have, yes.
Thank you very much, Violet. That is always a question that we can have a very long discussion about, because it's always what comes first. Some people say if entrepreneurs start creating businesses, governments will follow. And today our governments are still buying and consuming healthcare. Even if healthcare is free, it comes from some company somewhere across the world. So governments are saying we're buying from outside because there are no local solutions. Local solution people are saying we cannot create local solutions because we cannot guarantee the buying from the administration. So there's another topic I want us to talk about. It's related to kind of infrastructure, and we're getting to the government here. The first thing we see so many startups trying to link the buyer and the seller. If you look at it from a market term, there is a person who is sick, and then there is a person who provides healthcare services. Now, if you went to a shop to buy a product, and you would be sure that the label on the product will be correct, somebody has tested the product, somebody gives you a product, and if it's not what you bought, you can replace. Now, when you're sick and you're desperate and you're going to buy healthcare service, how do we guarantee on the continent today that the healthcare providers, this is something that is really, I don't know if it's underlooked, because there's a lack of doctors. How are we sure that our doctors are well trained? The certificate hanging on the wall is actually a real certificate. They are retrained. And if we're connecting many of our sick people to nurses and to doctors, how do we guarantee the quality and the service that these people deliver? How do we guarantee that the doctors are well trained, that the doctors know what they're doing, that the doctors are not acting on behalf of somebody? Professor Witt, you can start.
Thank you. This is very interesting, actually, to discuss. In our situation in Africa, and if I look at Ethiopia, there is no guarantee so far, I believe, because institutions these days do not have that much control from the government side beyond giving them the license to practice their services. The control system is very regular, and it depends on how the government decides to do it. Otherwise, the certification mainly is given to one person, and usually we don't find that person in that private institutions when we look for healthcare services. So we don't have any idea who the other person is. In Africa, in Ethiopia, if we take, you don't even dare to ask who that person is and what his profession is. You can just go and sit and receive the services that you are given. So this needs special attention right now due to the increasing number of resistance, which is mainly due to misprescription that's not required for the patients. And so that results in misuse of antibiotics in Africa, and we are seeing the trends of, antibiotics are becoming very resistant to most of the bacteria that commonly face.
So Violet, what is your experience with this situation of the quality of the healthcare providers?
So you find that there are associations that have been put in place by the government, and also you see, like here in Kenya, there is an association where you find all doctors who are there, and it's called the KMPDU, Kenya Medical Practitioners Dentist Union. So they're the ones who see whether if there is any misbehavior by any of those health workers, that is where they report to. And there are also other unions that have been formed by the various health workers. So they're the ones who follow up on them. But when it comes to an individual visiting a health facility, sometimes it is very difficult for you to know whether that person is an authorized member of KMPDU, all right? So that is why you find that, like here in Kenya, for an instance, there was someone who pretended to be a doctor and performed abortions on young people, and it wasn't according to standard, and he was jailed, okay, for his transgressions and also fined. But the thing is, to curb this, there should be automation of the supply chain of even medicines coming from the government, streaming down to even the rural areas, the public health facilities at the rural areas, all right? But sometimes you find that these particular medicines or drugs, they come from the government, but they don't reach the intended persons or the patients on the ground. And this is because of the lack of automation of the drug supplies. Yeah.
Thank you very much.
So M&D.
Thank you very much, Violet. We have about less than 15 minutes, so I want to touch on some areas. What you're saying is very important, but what we're trying to do, we want to see how can technology and entrepreneurship, how can young people create in Kenya? I know there is an app created by a doctor, a lawyer. I think it's called Lawyers Soft or something, where this lady has created a platform where you can check if your lawyer is a good lawyer, and So we're looking for interventions. It's been proven for 60 years. After doing something for 60 years, it doesn't work if it's not working. So we're looking for how younger people, initiatives like yours, how we can then start to create that change using technology that exists today. How can we say this doctor is trained, this doctor is retrained? How can patients be able to choose which doctor they go to based on the information they have? Because it's easy to connect patients to doctors on online platform. Even worse, because you can't see them. So how do you guarantee that? So this is also an opportunity for innovation, as Beza would mention, an opportunity for to create some kind of technological innovation. Because if you look at the entire value chain, as you called it, of healthcare, if you cannot trust the laboratory that takes the tests, analysis from the doctor, you cannot trust the results. If you cannot trust the doctor who gives the diagnosis, and you cannot trust the diagnosis that is given, you cannot trust the medicine that you get from the doctor. I mean, if there is trust, and then on top of that there is corruption, on top of that there is everything else, you basically doesn't help if you connect the patient to the doctor on an online platform. So these infrastructural gaps open also for enormous amount of entrepreneurial opportunities using technology. And that's actually something that is important for us to notice for our people. Yes. And one thing I want to also address is that distribution of health. So we have healthcare. We know that if you go to a city in an African country, you get a different kind of health care. You get, maybe doctors are there, maybe there are people who can pay, and then getting out to the rural areas. Betawit, do you see any area where you think technology can help to even out this playing field, to make sure a person who is in Addis gets the same health care as a person who is in a remote area? I can't come up with any village name in Ethiopia at the moment. Yes.
Yes, that's interesting question, and I would like to see the best practice in Africa in this regard, which is based on innovation in technology. And for example, the Tartu city in Kenya and the Vision city in Rwanda, they have tried to create smart cities to avoid migration of the young generation to the city, so that we could avoid overcrowding of cities who are filled with young generation who came to the cities looking for financial independence, technology, and infrastructure. So This is actually something that all Africans could think about, and innovators and entrepreneurs could focus on, creating smart cities which have the healthcare system, the technologies, and the infrastructures that young people could explore their potential without migrating to the cities looking for even, let's say, the healthcare system. We can look at this. These cities, if you are aware of them, they have technologies and healthcare facilities which have the standard healthcare and quality healthcare system in their capacity, so that people will not travel to big cities to look for this advanced healthcare in needs. So this is, I just want to mention that focusing on developing the rural settings to avoid the people migrating to the big cities and resulting in overcrowding is very important through innovation and technology. So this is how we can avoid the health inequalities in rural and urban areas. We should make it accessible in those settings so that there could not be a gap. There could not be a gap between rural and urban city areas. So I just think, since this is an innovation and entrepreneurship platform, that focusing on creating smart cities are a ways to address multiple challenges in Africa.
Yeah, and Violet, you talked about enabling environment, about the governments enabling this. This is also something about smart cities. Many of these smart cities are ginormous investments, but we still need to see smart cities that are not based on physical infrastructure and building skyscrapers. They're just smart cities that are like technological hubs that make it easy for people to connect and get access. Do you, Violet, see any change and willingness in the governments to narrow out this playing field, to say, we're creating interventions in Nairobi, how do we get it to reach the local? Is this an active thing, or does it just start in Nairobi and then by itself people take it out to the urban areas, or to the rural areas? Sorry.
Yes, I can say that that governments, some African governments are embracing technology. For instance, we can say that even in Kenya, we have various innovation hubs that are being supported even by the government, so that we can even have more technological or health interventions, all right, based on technology. And you find that these particular innovations, they're also streamlining, they are also reaching the people in the rural areas. So we can say that there is the willingness by the government to inculcate these hubs, all right, and empower the youth who are also developing these particular apps to bring them to fruition. And they have also even reduced tax for people who are depending on what you're bringing on board. So you find that right now, you find that the red tape has been reduced here in Kenya, to ensure that even investors who want to come in, and so that we can develop things, so that we can take it to even other countries in Africa, it is possible. So at the end of the day, it all boils down to the government in place and whether they embrace technology. Once they embrace the technology, you find a country is progressing.
Yes. And that's beautiful with technology, because once you embrace technology in one aspect, because you do not need to be physically present, you can spread out to many other aspects. Now that we're where we are in the discussion, I would like for each of you to tell me in 2 minutes where you like to see the technological advancement bettering, if there's any particular area or as a whole where you see gaps and where you think people should focus more on in bettering the healthcare outcomes, reducing cost and making things better for our people and the continent. Violet, you can just continue since you were talking.
All right. So what I'm saying is, I can say is like the African governments, like the ones in Central Africa, you find that internet penetration is very down. Okay, so I'm I'm not only looking at Kenya, but I'm also looking at African continents, because African as a continent as a whole, because there is this migration moving from one country to another. So you see, like here in Kenya, if it is data, it is available. But now I'm thinking, like, when I'm moving here, I go to Mali, or I move here, I go to Benin, or I move here and go to Central African Republic. Is there data there? Is there internet? Or I have to go to a hill so that I can access internet? All right. So I'm looking at a way where the countries that have embraced technology can convince their partners, other countries as well. The presidents can speak to their fellow presidents, so that this technology, even with regard to health, can be embraced by the other countries, so that even if you go to Central African Republic, you just feel like you are at home. Okay, so that is what I'm envisioning, an Africa where health technologies are rampant, and they're being scaled up to other African countries as well. Thank you.
Yes, and because that is wonderful, because if that happens, we can also share doctors,
Exactly.
we can share medical professionals, we can have a platform for standardizing education, just like you've done in Europe. A doctor can leave one state in the US to another state, and you know that when he's called a doctor, you know what you expect that person is educated in. And if you can land in Central African Republic tomorrow and you get sick, you know that if you get to a doctor, you don't need to come to this Kenyan board to check if that doctor over there is trained. So in this sense, if we lift the discussion one step up from where we are, we realize that there is, as you said, the enabling environment in each country, but there must be a stronger enabling environment in the inter-African solutions, because most problems we have in these African countries are the same. So if you can create a solution in one place, as you say, you can rightfully take it to another place. That's very good. Thank you very much. Bezawit.
Yeah, thank you. That was an interesting point. And what I would like to add is, the question of connectivity have limited our potential that we already have. We couldn't exert it because we don't have connectivity even within the country in different parts. So, for example, the use of telemedicine, for instance, is tremendously important in Africa due to our few number of doctors in each countries. So if you have telemedicine, we can just share the doctors with the remote healthcare providers, sharing their expertise and their inputs to treat patients in remote areas. So connectivity is very important to even expand the technology implementation within the country and as in Africa in general. And we have seen the impacts of this due to COVID-19. We didn't have that overwhelming impacts of COVID-19 in Africa as it was feared in terms of the illness itself, but it has stretched the poor infrastructure of healthcare system in Africa already. This is because we don't have a healthcare system which is very strong in terms of technology and infrastructure. So we need to see this gap when we develop technologies and innovation, so that for the future our healthcare system could be resilient and sustainable, even if we have similar pandemic like COVID-19. So investing in technology and connectivity and modernizing our healthcare system, which could use the scarce resource in the system already, is very important in my perspective. So, for instance, self-care and telemedicine, where we have seen this technology has been very helpful during COVID-19. So we could focus on expanding such innovative and particularly in terms of connectivity, it's a very challenging and important area to focus on.
Great. So if one put the same amount of effort we put in fintech to get people financially on mobile money, and use the same energy to get into the healthcare sector, you can be rich, but if you're rich and sick, you're not very far from anything else you can be. So if you can so you're saying that if we put this connectivity issue into our healthcare sector, and as Violet also said, it's basically the same thing, get the connectivity across the continent, it can leapfrog us. It can make us go much faster in advancing our health outcomes because we can share experiences much easier. We can share solutions much easier. We can share best practices and create standardization across the continent, which is what has lifted many other countries across the world. And we've not talked about this, but this is a big issue. COVID-19 has opened the eyes and the understanding of many people to a future of healthcare, which has to change. We know that coming 2021, we'll still be dealing with COVID for some part of the year. About how contact tracing, how are we going to use modern technology, not only information technology, but technology and science as a whole, to lift the continent from where we are in health to a future where we control our own healthcare. So this has been great, and thank you very much for joining in today. I wish we can continue the conversation for a long time on different aspects. I hope we can continue the conversation on some of the platform. Thank you very much, and all the listeners out there. It's been a great morning. Thank you very much, and have a good time. Have a good weekend, everybody.
Bye.
Pleasure.
Thank you.
Thank you.
You all. Bye.
Bye-bye.